Hello once again, beautiful people. It is your tooth doctor right here, Maureen Mora. If you are new to this channel, welcome. In this channel, we purely talk matters oral health, and our current topic of discussion has been dental fluorosis. In today's video, I'm basically going to talk about the different severities of dental fluorosis and how to manage them. We have a very mild fluorosis, we have mild fluorosis, we have moderate fluorosis, and we have severe fluorosis. In the case of very mild fluorosis, normally it is very unnoticeable, not unless you are that kind of a person who's very sensitive on how you look. And if you visit your dentist, they are likely to tell you just to maintain good oral hygiene because nothing is normally done at this point. On mild fluorosis, this is where the tooth starts to turn some chalky white, some to mild yellowish appearance on your. At this particular point, again, it is unnoticeable. But then your dentist can advise you get bleaching done if at all it is necessary. When it comes to moderate, this is where a minimal part of your tooth structure has discolored and the rest of the tooth is of good quality and everything. At this point, your dentist usually removes the discolored part and a filling is done on top of that area. This procedure is normally called masking. The good thing is currently I was in a conversation with a certain dentist and he said even the government hospitals are offering that. So if you are out there, there's some small patches and you feel like ignoring them because of the price, because of the cost in maybe a private institution, you can as well visit the public hospitals. They will be in a position to offer you good assistance. Then we have now this severe fluorosis. At this point, you find that a big tooth structure has been destroyed. So what we are looking at in terms of the treatment is either a crowning or veneers, depending with your financial capability. So that being said, currently there was a study that was carried out by a group of dentists, and it happened that as at now we have approximately 19 million people who are affected with dental fluorosis. And within the Nairobi metropolitans, the areas that they found high fluoride levels were places like Utawala, Ruai, areas of Ngong, and Athi River. That is within the Nairobi metropolitan. And of course, we have the Great Rift Valley, places like Nakuru, Kericho, Naivasha. Now tunaelewa basically it's because of the volcanic disruptions that usually happens on those areas. So how are you going to tell if your water has fluoride? Basically, if you stay in a place where your water supply is constant, ama umejenga kwako, and you have small kids and you want to protect them, you just take a small sample of your water to the national laboratory. I believe even KEBS does that. They will check on your water. But then if the fluoride levels are quite high, that is anything above 1.5 parts per million, then I'll advise for now, there are some companies that have these defluoridation machines. I will advise you get one from them. But again, these things are quite expensive on my personal look. So if you are in a position to acquire one, good for you. But then for a common mwananchi, it is difficult for them to get such a thing. And that means it basically goes back to the government side, whereby they have to ensure that people get enough water enough piped water, which is certified, and the fluoride levels are of normal quality. If that is not done from maybe the government side, from us clinicians, the little we can do is wait for you at various facilities and manage the outcomes. So if you are in a position to get the filters done, please do so. Then another worrying thing is most of these procedures, be it masking, be it bleaching, be it those crowns and veneers as mentioned earlier, most of them are not covered by insurances, not even NHIF. Something I find quite unfair, because this population did not choose to have that condition. But then do what you can do. I've given you the various tips on how to go it, so you'll thank me later. So as I wind up, I wanted to inform you that high levels of fluorosis may not affect teeth alone. It can also affect your bones, something we call skeletal fluorosis, which is irreversible, because unlike teeth, it is evident. Your doctor or your oral health practitioner can correct it for you. But for skeletal fluorosis, it is unnoticeable and it can happen throughout life. Please share to your friends or those people who you feel this message is of importance to them. Thank you so much, and let's meet in our next video.